Your face isn't random, it's a map. Face reading is an ancient practice used in Chinese medicine, TCM, Ayurvedic systems, and apparently indigenous traditions. I learn something new all the time too. The face reflects the nervous system, organs, emotions, and long-term stress patterns. It's not about labels or diagnosis, it's about listening. Changes in texture, tone, tension, and shape tell a story about how the body has adapted over time. When you learn to read the face, you learn how the body is asking to be supported, physically, emotionally, and energetically. You can see a lot on the face, and the face can change as well over time, or with traumatic events or being under long-term stress. There's a lot you can read from the face. There's also 9 different face shapes, so I am a tree face with jade aspects. Got a lot of angularness to me. It means I'm a little aloof, and quite honestly, I'm rather naive sometimes. Ignorance is bliss half the time, quite honestly. But tree faces also indicate that you're deeply rooted, you're protective, and you can weather the storms of life. Which, if you knew my whole history, that makes a lot of sense. So there's a lot of cool things to read on the face shapes, the organs, where they're placed, how they can affect your health. If you are a doctor, such as a traditional Chinese medicine practitioner, an acupuncturist, a chiropractor, a naturopath, you can use this to diagnose patients and assign supplements and medications and stuff. I can't do that under my scope of practice, but I can make suggestions based upon emotions I see on your faces in regards to how to deal with that, and refer you out to doctors or practitioners that I have a good relationship with. So I can't actually diagnose you with any kind of condition, and I can't give you any kind of medication or supplements. I can make suggestions that you then talk to your health professionals about and make a determination from there. However, me personally, because it's not under my scope of practice, I'm focusing more on the emotions that are on your face that are stored there, and asking you some out of emotional release questions in order for you to process what's going on and potentially shift that energy. And what may be happening in your face could also be showing up in your body. So if you're expressing, maybe you have a lot of anger here, and women, we tend to hold in our resentments, so we get the hooding over our eyes, that of course we then get our faces pulled up to, be a little vain, which is fine. But if you're holding on to anger, you may also have like headaches, pain underneath the point of your right scapula, that doesn't go away with anything. That is a referral pattern for your liver. So there's different associations you can make in regards to the face and the body, and then the emotions. And if you can shift some of that, you can potentially change your health without drastic measures.